Hello, good morning, everyone. Okay, thank you for giving us your time here. I really appreciate all your time. Okay, so today we are going to learn about how we are going to use Healy as well as MagHealy, okay, to support our bone, muscle, and joint health, okay, so that we can stay active and free from pain. Okay, so before we begin, okay, I'd just like to bring to your attention for those who need Chinese translation, you can select at the interpretation channel, okay, the Chinese language, and Manda Chia will be our interpreter for today. Okay, so we begin by introducing ourselves. I am Zirong. Yeah, I'm a A-level bio teacher by training, and I have been teaching for over 25 years now, and I still like to teach. And that is the reason why we have this video presentation here to share with you, okay, my experience and the knowledge that I have. So I have been trained quite broad-based in the physical aspect of the body, from cellular nutrition to meridian acupressure, the 5-element system of traditional Chinese medicine, redox signaling, even geopathy as well. So through a series of video presentation like this, I will be sharing different aspects and linking Healy together so that we can really, maximize the potential of our dear Healy device over here. So I'll also mention briefly about our interpreter today. She is Manda Chia. So she is trained mostly in the body, mind, and spirit, the healing of body, mind, and spirit. So she is also very broad-based, covering across the different belief system, okay, the different value system. And she has also been involved in spiritual healing for over 20 years. Yeah. So together, I see that we are making a good pair because I am well versed in English. She is bilingual, and I am broad based in the physical body, and she is broad based in the other aspects of mind and the spiritual body. Okay, so I think it is a privilege to have her to do the interpretation for us today. Okay, so I will begin with this disclaimer here to remind everyone that this sharing here today is based on my own personal experience and understanding from published scientific materials. The intention of this sharing is only to guide Healy users on the usage of IMF, individualized microcurrent and frequencies to empower the cells in the body to optimize our performance and maintain a balanced state of well-being. The content of this sharing are for educational purposes and are not intended to offer personal medical advice. So you should still seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking a medical professional because of something you have heard on this presentation. So this sharing, again, I repeat, is not a medical claim, and it is your responsibility to do your own due diligence before applying what we share over here. Okay, so today we are going to learn how to use quantum frequencies to improve our bones, our muscles, and our joint health. Now, why is it important? These are the top reasons for loss of mobility and independence as we age. Okay, one of the top reason is arthritis, joint pain. joints. It could be finger joints, it could be our knees, our ankles, our hips. These are all joints. Okay. There could be accidental fall leading to bone fractures. Diabetes can also cause amputation and the loss of limbs. Stroke can lead to the loss of muscle strength and the loss of nerve function. Therefore, the arms and legs are not able to move properly. Obesity, that means the heavy body weight, pressing against the joints will help to speed up, the wear and tear. And high impact activities, for those who like to engage in adventurous, high risk activities and all that, can lead to lots of all this mobility. Okay, so anyone and everyone should take care of our bones, our muscles, and our joint. Okay, when those who are early, you watch the video. There are two videos. The first one is about, loss of mobility. And the second one is to show how we were gifted. Most of us were actually gifted with a healthy, beautiful body. So the first video actually showed us a look inside our body, which we can't see the inside of our body. And you can see what a beautiful world it is inside our body. But as we age, degeneration, aging will start to take place. And that's where we start to degenerate. And according to research, on average, an adult from 20 to 80 will reduce or lose muscle mass by 40%. Okay, and our cartilage, I'll tell you where the cartilage are later on, will also be decreasing with age. So this is part and parcel of aging, but we can actually reverse aging if we do something about it right now. Yeah, and today we are going to show you just how to do it with our Healy and MagHealy. Now let's take a look at bio, okay, our body. Now our body is made up of trillions and trillions of cells, okay? And they form systems, organs, tissues. And then smaller than the cells will be organelle, macromolecules, molecules, atoms, and smaller than that will be the energy within the cell. So where we are coming from, okay, where frequencies are concerned is we are supporting the body at the quantum of the energy. Okay, yeah. So I think this is an area where not many of us are well acquainted with the use of frequency to create a balanced state. So that is what we want to show you today. All right. Now the cell has many parts inside the cells. We are not going to have a deep bio lesson today. I just want to quickly run through that on the boundary of the cell is what we call the cell membrane. So now every day we take salt, okay, electrolytes. And what are these electrolytes like sodium, potassium, chloride, in our daily, what we call the table salt, edible salt. Okay, they are actually used to maintain what we call a membrane potential. So these are charges, these are electrical, and they are very, very small current, which is measured in millivolts. Unlike, the plug that you see at home is in how many hundreds of voltage. This one is in millivolts. That means at least 1,000 times lesser than the very, very strong current. And this is called microcurrent. So in Healy, we use IMF, individualized microcurrent as frequency. So this microcurrent is this little, tiny little amount of current that we pass through our body. Okay, now let's take a look at the bone structure. Now, the bone, we are familiar with the outside of the bone. Now, the inside of our bone consists of a compact bone and soft bones. Soft bones is where you will find the bone cells. Yeah, bone cells. So the bone is actually alive. Bone is alive, and there are living cells in the soft bones. That's why you can see here the blood vessels here delivering nutrients to the living cells in the soft bones. Yeah. And then you have the compact bone, which is the hard bone on the outside. Okay, and that is the part where the calcium, okay, are deposited in between the cells in order to make it hard, very, very hard, that it can pick up, 60, 70, 90 kg of our body weight. Okay, all right. Then outside, there is a layer of what we call cartilage. So there are three layers: soft bone, compact bone, and the cartilage. Now, joints. Joints is where two adjacent bones meet each other. That's a joint. Okay. So when we talk about bones, we talk about density of the bone. Yeah. So joint is where two bones meet, and every time we move, they will be rubbing against each other. Okay. So to protect the bone from being eroded with time of rubbing, friction, and all that, there is a layer of tissue here that we call the cartilage. Yeah, this is the cartilage. Okay. Now, as the two bones, if degeneration takes place and you don't replace the cartilage, which is made of glucosamine and the chondroitin, then what will happen is that as it wears out, the two bones start to rub against each other, and you will start to feel pain and inflammation will start to take place. Okay, so that is the reason why we are taking the glucosamine and chondroitin. This is actually for cartilage. When we take calcium, it's actually for bone density. Now, in between the two bones here, there is a layer of liquid called the synovial fluid. This is for lubrication and also to absorb the impact. So there is a little separation between the two joints here. In case, every time we jump, there is impact, so it will be cushioned by this synovial fluid. Yeah. So there are people also with joint issues where there is a leakage or loss of the synovial fluid. So every 6 months, you need to go for an injection to replace that synovial fluid. Yeah, so that it will absorb the impact of any shock. Now, for the joints to function and for the bones to function, you need, okay, ligament. Okay, ligament holds the two bone in position so that they don't slide out. When it slide out, okay, then you cannot move your limbs properly. That's where you get a dislocation. So you need the ligaments to hold the two bones in position. And what is tendon? Tendon will join the muscle to the bone. All right, that is the tendon. So you need to take care of the muscle as well, because muscle, when it contract, so muscle will contract. So when it contract, it actually is strong enough to lift the bones, okay, to lift your legs and all that. So in order to have good movement, we need to take care of our bones, which is the bone density. We need to take care of the cartilage, and then we need to take care of our muscles as well as tendons, ligaments, which are made mostly from protein and collagen. Synovial fluid is also made from proteins. Yeah. Okay. And yeah, so these are all the different areas that we need to take care of. Okay, so today what we are going to learn is firstly how to relieve pain when the joints are inflamed and there is degeneration of the bones and joints. So first, pain. This is the first sign that allow us to know that there is something wrong with our bones and joints. Our body will always give us the signal. So what we do is we use microcurrent. So with a microcurrent, how it helps is if we are using very, very low levels of electrical current to stimulate the muscle, ligaments, and joints. It is very safe, okay, because it is very mild. The strength is very, very mild. And you may not feel anything at all, or you may feel slight tingling sensation. You may feel warm. It is non-invasive. It is actually painless. And it helps in reducing swelling or inflammation. Okay, now it will stimulate the cells in those areas where we stimulate, where we do a local stimulation. Those cells there will increase ATP production. What's ATP production? This is what we call cellular energy. This energy is needed for the cells to work and to function. So the energy production is going to increase by 500%. All right, this will help to repair, the injured tissue a lot faster. And the stimulation, if the muscles are very tight and stiff, so when you use stimulation, it will loosen, soften the muscle so that the muscle can actually contract naturally. Otherwise, it will forever be in a contracted state and it becomes very, very stiff. So this is the reason why we go for massage. The massage is actually to loosen your muscle when it becomes very stiff. So now we can actually do it using microcurrent. These are articles that is independent of Healy to show that out there, there are therapies using microcurrent and it is safe to do so. They call it bioelectricity and microcurrent therapy. And professional sportsmen, because they have tissue injury and after a competition, after a game, they will go to their respective therapies in order to get this kind of therapy to relax and loosen and allow the muscles to heal quickly, Yeah, and the results have shown that microcurrent appears to play a significant role in the healing process and that microcurrent can promote healing in a variety of bone and skin lesions. Now, another one shows that short-term microcurrent, electrical neuromuscular stimulation can actually improve muscle function in the elderly. So as mentioned earlier that the elderly may actually lose a lot of muscle mass. So by doing the stimulation, it will trigger the muscles to start contracting and then increase in the muscle mass so that they are able to then move and gain their muscle strength again. Yeah. Okay, so in Healy, if you want to use the microcurrent therapy, you will choose the local stimulation program over here. There are 8 programs. So those that are related to what we are talking today is program 1, which is for chronic pain, program 2 for back pain or spinal pain, and program 4, which is for joints. You will need to use the cable, yeah, the cable here, and then you will also need to use the gel pads. These are the gel pads. So you can see over here, the black spots that you see here, this is to show you exactly where to paste the gel pads. Yeah, so you use this head, the terminal here, you click here, The other one, you will do the same. Okay. Then the other ends, you will insert into the two terminals that you see over here. Okay, so these two just paste on the respective region that you need. For example, this top one here is for neck and shoulder pain. This is for waist and your lower back. This is for your shoulder pain. This is for elbow pain. And this is for knee pain. Okay, so one stimulation program will take about 20 to 30 minutes, depending on which program you have selected. So you just need to adjust the strength of the current according to what you need. So this is the reason why we call it individualized microcurrent, because when you paste the gel pads, you will increase the current until you can feel a bit of pulse or tingling sensation. Okay, that will be enough. Or you can bring it down a little bit by 1 notch and use it for the required time period. Now, at the end of it, if you feel that, it is still a bit tight or not to your desired level, you may increase, you may repeat again the process a few times a day according to what you need. Okay. Yeah. All right. Now, who should not be using microcurrent? I just want to bring to your attention that if you have inserted a pacemaker or you have implanted pumps that are battery operated, you should not use microcurrent directly, because we do not want any interference with the batteries and any electrical devices that is implanted in your body. And then if you are pregnant, so we do not encourage you to use microcurrent, not because it causes harm. It's just that we just want to have proper precaution, yeah, not to disturb pregnant women. All right. So you may have to use other methods. Then if the person is having seizure, okay, during the time when they have seizure, you're not supposed to use microcurrent stimulation. Now, if there is bleeding, okay, infections where there is open wounds after a surgery, yeah, before the wounds actually closes, yeah, so these are the time when you should avoid using microcurrent, because we do not want to increase blood flow and circulation and cause you to bleed unnecessarily. Okay, now always remember to drink plenty of water, to be well hydrated, because the water is the pathway for the movement of the current, because the water allows the electrolytes or the ions to actually circulate and move within the cell. So I would suggest to drink water at least 20 minutes before you want to do a local stimulation, so that the body, the cells have time to absorb the water. When it's well hydrated, you will then have better effect, because the current can move easily. And then we are going to talk about how to repair and then allow the new cells that is inside to regenerate. Okay, so now let's move to the next part. Okay, in the next part, we are talking about how to repair cells that are damaged, and if they are no longer usable or repairable, the body will naturally remove them and allow new cells to take over. Now, one thing interesting is that the cells that are supposed to divide and give us the new cells They are called stem cells. Okay, so in the bone, the stem cells that are found in the soft tissue of the bone is called the mesenchymal stem cells. It doesn't matter, don't need to know their name. Now, the stem cells can differentiate and become our bone cells, our cells that are produced, that will produce the cartilage, okay, and then the tendons, the ligaments, and all those cells within near that region there, okay, will have to come from the stem cells. Okay, now, the stem cells as we age may actually become, I would say, less active, or they are inactivated. They don't have the right kind of hormones to actually stimulate it to actually divide. So if the stem cells are not dividing, do you know that the old cells will always continue to have to keep working? All right. So there must be a way for the old cells to actually die and remove and create a space. So when there's an empty space, then only your stem cells will divide. But if your stem cells won't divide, there is no way the cells will tell an old cells to actually, retire and go away and make space for new cells. So these two come hand in hand. All right. So therefore, it is important to actually stimulate and get the stem cells back to the times when you are younger, where they are ready to divide and then replace the old damaged cells. Okay, and to do so, we can use this particular program called the vitalization, bioenergetic vitalization. So you see here, to use this program, right, is to first stimulate and wake up the stem cells, so that they know that they need to start working. So we need to use regeneration, this program, once a day for 7 days or 1 week. The following week, week 2, you will use regeneration 2 for once a day for 7 days. And after that, you will use third week regeneration 3 every day 1 time for 7 days. Each program here is about 30 minutes. Now, these 3 staging is to prime or prepare the stem cells in the body. Okay? And from the 4th week onwards, you can then start to use all of these other programs here. All right. So now today we are talking about bone health. Yeah. So for bones, this is the program to use. Yeah. Use the bone program so that it will target the bone cells to actually divide and grow new cells and strengthen our bone and bone density. All right. Then you can use cells here for generally all the cells in the whole body. You can use tissue also. Tissue will include connective tissue. All these will include the tendons and the ligaments. Yeah, the muscle cells. Yeah, all these will be under tissue or cells. And then if you want basically the whole body to become younger, you can use. But let's say if you have a severe condition, you may just want to concentrate on that particular area for the time being. Okay, so this is how you use the vitalization program. Okay, now, when you want to grow new cells, I equate it to like making a baby. Okay, so why so? You see, when a mother is pregnant, their parents will always advise them, or doctor will always advise them, you eat healthier, eat more, because you're now eating for 2 person, you're not eating for 1 person, correct or not? So you see, to make a baby, you need to put in raw materials, building blocks, okay? Yeah. So here, to make a new cells, we need to put in the raw materials. So therefore, our diet is important. So diets that are high in proteins, omega-3, okay, fats, vitamins, yeah, that we're going to see later on, okay, will be helpful because you cannot be using vitalization, okay, make new cells, but you don't provide the raw materials for the new cells to form. Okay, so please complement with a good, healthy diet, and you can increase your collagen intake as well. Fish collagen is good because the fish collagen molecules are actually small and therefore easier to absorb. Now, collagen, we always think that collagen is mostly found below our skin, but actually you see collagen, 90% of the collagen in the body is actually distributed to our bones, our tendons, our muscles, our ligaments, our cartilage. Okay, yeah. So, all right, so here, now what is the collagen for? The collagen will also help to increase our bone density. This is the holes. So you see here, this is a high bone density structure that you will see. Now, besides collagen, you will also need all these different vitamins and minerals. You see, because sometimes we think that, okay, we just eat the collagen, it will absorb. But to produce high quality collagen, okay, that means to prevent breakdown of the collagen and to strengthen the collagen structure, we need B2. We need B3 to improve the elasticity so that it can withstand the tension. All right, then we need B7, we need vitamin C, okay, to form these other compounds. Then we need vitamin E, yeah, and then we need copper, we need zinc. So we actually need a whole cocktail of nutrients. And then we don't just need calcium alone. Calcium alone is not sufficient. And calcium, magnesium, zinc, and vitamin D, which is found in most of the supplements outside, is actually also not sufficient. So we need even all this copper, we need manganese, we need phosphorus, we need selenium to reduce inflammation and all that. So the whole cocktail and cluster of minerals, okay, will help to ensure that we have good, strong bones, joints, and muscles. So besides getting it from your diet, sometimes we have elderly who may not be able to digest your food properly, may not be able to absorb your nutrient properly, and okay, you may not have the full set of all the ingredients required to make strong bones, cartilage, muscles, and joints. Okay, we can also energetically supplement it through the frequencies that are found in our digital nutrition mixtures in Healy. Okay, now I'm going to go through a few of these to explain to you how this can actually help us. Okay, amino acids, okay, or proteins. These are called amino acids because they are already proteins broken down to its smallest possible molecule, and that is the amino acids. So this is for our collagen, for our muscle proteins, and for all kinds of proteins, we need amino acids. So we are putting in the full set of amino acids that the body needs. And then minerals, I show you a whole cocktail of minerals. So here we have all the minerals, the full set that we are going to receive over here. And you can also use the vitamin B complex because it's shown there. We need some of the vitamins as well. Okay, so you can also use this one, the hypovitamins, to get all the necessary vitamins. Okay, then connective tissue will be for the muscles, ligaments, and the tendons. Cartilage, all these are under connective tissue. So this is a mixture, already a mixture of all the ingredients that you need to actually strengthen your connective tissue. Now, digital nutrition 5 also have structure. Structures here include your bone muscle structures, mobility for your joint activation, and then to be energetic will be the nutrition that is necessary to produce energy for the cells to actually grow and make new cells up. So these mixtures you can use to actually supplement and give the body what it needs to make the new cells. Okay, right.